You should take your health into your own hands. And that's where a lot of people are going. It's like a lot of the big message nowadays is to take your health into your own hands.
Yeah.
Do not let a primary care doctor, someone, be the only person that you talk to, because they're only going to, like, I know a lot of, we call PCPs, right? And that's a drug name also, but it's PCPs are primary care providers, right? And we use that term all the time. But in the world of PCPs, they are screening. They're screening and throwing patients at the different specialists that where they need to go. So you have like a family practice doctor. They might maintain that patient for years and years, maybe a decade, and try and manage all the chronic stuff that's going on. Eventually, something's going to get too far down the road for them, and they'll just refer them out to specialists, right? So they're not going to manage them anymore for that thing, right? That's what they're doing. During that whole time, they might give some advice. They might encourage you to be healthier, but they're really just observing, disease states. I'm observing that you're sick. I'm observing that you're not sick.
Yeah.
Like, you came in today and I observed that you're not sick. And I will give you some token advice on how to be healthy.
Right.
Like, get more exercise and eat less, right? Those are my token pieces of advice for you, right? But I have observed that you do not have this chronic illness right now.
Right. I don't have another pill, a toolkit in my way to do anything other than that.
Right. So that's what they do that day. And you come in and that annual well check, they might look at your blood work and all this other stuff. Looks good. Well, I don't have to refer you out to someone this time. Yeah, congratulations.
It's like a mechanic. You take your car in, to get the oil changed, and you say, hey, just check it out. Is there anything else? And they're like, no, there's nothing else. But if you really look at it, well, there's probably some ways that you could improve the car,
right? So, so there's all those things. But again, primary care doctors aren't necessarily going to be like they're not going to be your health coach.
Right. They're not going to tell you, they're not nutrition analysts.
They're not going to do all that stuff.
Yeah.
Right. They're only going to see you when you need them because you're sick. Yeah. Right. And there's nothing wrong with that. Somebody's got to do that job. Like, somebody's got to do that, but people mistake their primary care doctor as the only person that they're going to talk to.
Yeah.
And, or the only person that is going to help them with something like that. So if they don't tell them, no. Well, first off, I should joke that patients won't do anything doctors say anyway. So it doesn't matter whether so like the doctors, that's one of the number one problems doctors have is patients won't even follow through with their advice. But if you're going to say the only advice I'm willing to go seek is from my primary care doctor, and you still won't follow that, so it's just But you should take your health into your own hands. If you want to avoid a chronic illness, you should definitely take your own health into your own hands. You should study. Again, like I can list like really 3 little simple things that could probably keep someone super healthy, right? Simple thing number 1, the majority of the food you eat is fresh and not processed. And I say majority because you almost can't avoid it nowadays. Some stuff's processed, right? But if I would say if 3/4, 2/3, 3/4 of all the actual calories you eat in a given day are from some sort of whole and fresh food. I'm not even saying go vegetarian or vegan. I'm just saying whole and fresh foods with no ingredient list, right? If that's what you're eating, like, your health is probably going to spike up in benefit, right? And it should probably be vegetables and fruits, right? But I love raw almonds. They don't have to have salt and oil on them, right? They taste great. They're kind of sweet, right? I'll eat raw almonds as my snack. There's just a ton of fresh and fruits and vegetables that I like eating, and I'm the first person to go after a chocolate bar. I got a half-eaten chocolate bar in my office right now, and every few hours I'm going to take a piece of that, and my wife and my kids will joke that I have a sweet tooth. I'm like, well, yeah, every now and then I want to go after something that cookie looks really awesome,
Right.
It's like, it's fine because I don't do that all day every day. So, but the majority of what I eat is something that's whole. Right, something that is a fresh or a whole item. It's not processed. That's where the garbage is. Mm-hmm. Right. So avoid the processed foods. Eat whole stuff. Right.